Welcome to this educational video about total shoulder replacement surgery. In this video, you will learn what to expect when you go for your shoulder replacement, both before, during, and after. If you have any questions, please make sure you ask them at this office visit today, or call the office if you think of any questions after the fact. In the month prior to your surgery, you will have a pre-op appointment with your primary care doctor. At this appointment, please make sure that you review any prescription or over-the-counter medications that you take. Specifically, if you take any over-the-counter blood thinners, such as a baby aspirin or aspirin 81 milligrams, or any supplements, you should make sure to discuss those with your doctor, as they should be stopped 7 to 10 days before your surgery. If you're taking any pain medication before your surgery, please also discuss this with your primary care doctor. You can take arthritis strength Tylenol for pain prior to your surgery, but should not be taking any NSAIDs such as Advil, Aleve, ibuprofen. Before your surgery, you will receive a call to schedule a time to pick up your ice machine and show you how to use it. It will be programmed to cycle for 60 minutes on and 30 minutes off. It's important that you pick up your ice machine prior to your surgery so that you have it available to you as soon as you get home. Make sure you pick up your prescriptions before the day of your surgery. You want to make sure that you have them available for you as soon as you get home. The day before your surgery, please clean the shoulder you'll be having surgery on with the chlorhexidine that you've been given. If you've been given the chlorhexidine wash shown at the top, take a shower the night before your surgery using half of the bottle of wash. Dry yourself with a clean towel, put clean pajamas on, and go to bed. The morning of your surgery, take a second shower using the remainder of the bottle, dry yourself with a clean towel, and come to the hospital. If instead you've been given the chlorhexidine wipes, you shower with antibacterial soap the night before your surgery, dry yourself with a clean towel, and then use one of the wipes on the shoulder you'll be having surgery on. Let your skin air dry before putting clean pajamas on and going to bed. The morning of your surgery, use the second wipe to wash off your shoulder, let your skin air dry, and then come to the hospital. Please do not shave your armpit for 5 days prior to your surgery, and do not use any deodorant, lotion, or powder on your surgical arm prior to leaving for the hospital. You will get a call from the hospital or surgical center the day before with your arrival time. You will need to have someone to drive you home from the hospital or surgical center, as you will not be able to drive yourself. You will need to get COVID tested approximately 3 days prior to the procedure. Do not eat or drink anything after midnight the night before your surgery. If you're having your surgery at mid-state, you can drink 12 ounces of Gatorade up to 2.5 hours before your scheduled arrival time. Unless you have been told not to take some of your medications, you can take your medications with a sip of water the morning of your surgery. Once you arrive at the hospital, you will meet your anesthesia team. As part of your anesthesia, you will be given a nerve block to numb your arm, which can last roughly 24 to 48 hours after your surgery. Before they do your nerve block, your anesthesiologist will explain to you exactly which parts of your arm you should expect to go numb and how long it should last based on the types of medication that they use. Once your nerve block starts to wear off, you will feel a tingling sensation in your hand and arm, which may last for several hours. After you've had your surgery and you are comfortable, you will be discharged home. Once you get home, it's important to start using your ice machine as soon as possible. You want to make sure that you use your ice machine around the clock, especially when you're sleeping. Place your cooling pad under your sling, but over a shirt, so the pad is not directly over your dressing. If you're not getting an ice machine, you may use ice packs for 30 minutes on and 30 minutes off. You should have several available in the freezer for you at all times so that you can rotate them. You should plan on sleeping in a recliner or upright in bed for the first few weeks following your surgery. It's important that you are not sleeping on your side. After your surgery, you will have to wear a sling or shoulder immobilizer for approximately 4 to 6 weeks. You are not going to be able to drive until you are out of that sling or immobilizer. Before you're discharged from the hospital, make sure you understand how to remove and put on your sling or immobilizer so that you're able to do it yourself once you get home. After your nerve block has worn off completely, you may start using your lower arm from elbow to hand. It's important that while you're using your lower arm, your upper arm does not move away from your upper body.
This is okay. This is okay. You can do this to brush your teeth. You can type on the keyboard. You can put deodorant on or get dressed. But at all times, you shouldn't be doing this. You should be doing this.
On the 3rd day following your surgery, you should start doing your circle exercises. These exercises are very important to help avoid frozen shoulder.
3 days after you've had your surgery, you can start doing your circle exercises. You'll want to take your arm out of your sling and let your arm drop to the side. Then if you need to, either hold on to something or sit down, make sure that you're feeling steady, and then gently lean forward so your arm is hanging, letting gravity do the work, and then slowly circle your arm in a 3-inch circle. You want to do 30 circles clockwise and 30 circles counterclockwise. You want to be gently moving your arm, and this is going to help you prevent frozen shoulder.
4 days after your surgery, you may remove your outer bandage and take a shower. You will have steri strips covering the incision, which can get wet, but should not be scrubbed. After you take a shower, you can pat your incision site dry. You may use baby oil to remove any surgery adhesive or alcohol to remove any skin marker residue that's left behind. When you're getting dressed, make sure that you keep your upper arm against your body and only move your lower arm. Bruising and swelling on your hands and fingers are normal. You can use a stress ball, rotate your wrist, or flex your elbow to help increase circulation. Call the office if the swelling gets worse or you experience any redness, heat, or pain.
When you're getting dressed, it's important to make sure that you're not moving your arm away from your upper body. So what you're going to want to do is when you're getting dressed and undressed, you gently take your arm out of your sleeve and let it hang to the side. Then you can slowly lean forward as if you're doing your circle exercises. This is a good time to stop and do those 30 exercises in both directions. Then what you want to do is take the shirt that you're putting on and gently put the sleeve of your operative side on. At this point, if it's a shirt that's going up and over your neck, you want to pull your shirt over your head. If it's something like this that's going to go behind you, you can stand up, let your arm hang to the side, and then go over. So then, once this arm is securely in the sleeve, and it's either over your head or behind you, you can then put your non-operative arm in your sleeve, and then you can put your sling back on.
Before your surgery, you will have picked up your prescribed medications from the pharmacy. These medications will include a pain medication to help control your pain after the surgery. This medication is very effective to treat pain when taken for a short period of time, but has side effects and serious risks such as addiction and overdose if taken for too long or at high doses. It's important that you stop taking this medication as soon as your pain allows. Do not take this medication with any other medications that might make you drowsy, such as sleeping aids, alcohol, illegal drugs, muscle relaxants, or anti-anxiety medications. When you first feel pain, you should take your prescribed pain medication. Make sure you have something to eat first so that you're not taking your pain pills on an empty stomach. You can also supplement your prescribed medication with Tylenol, ibuprofen, or Aleve, or alternate your prescribed medication and over-the-counter medication in a method that works best for you to manage your pain. When you pick up your medications, you will also be picking up an anti-nausea medication. Not all patients will need this medication, but we want it to be available to you in case you experience any nausea after your surgery. Additionally, you will need to take one baby aspirin twice a day for 4 weeks after your surgery, unless you've been specifically told not to by either your primary care doctor, cardiologist, or any other specialist you might see. Long term, you will need to take antibiotics prior to any dental procedures, colonoscopies, and invasive gynecological procedures for the rest of your life. Our office can prescribe these antibiotics for you, so just give us a call before you have any of these procedures. Thank you for watching this educational video. If you have any questions, please ask them at your visit today or call the office. Good luck with your surgery.